Good afternoon, everybody. Just going to let the room calm down a little bit before we start. I'll just give it sort of 20 seconds or so, and then we will kick off. Welcome, and thank you very much for joining us. With you in a few moments. Right, I'm going to get started. That's okay. So good afternoon, everybody. My name is Richard Ayres, and I'm a social care advisor to Care England, and I want to welcome you to our joint Hempsons and Care England webinar titled CQC, Where Are We Now? Where Are We Going? And How Do I Best Prepare My Service? Today's session is focused on helping providers navigate where we are currently with the CQC Single Assessment Framework, and what changes are emerging, and critically, what you should be doing now to best prepare your services. We'll be exploring how the current assessment approach is operating in practice, alongside the latest CQC consultation on proposed changes to the quality statements and the reintroduction of clearer ratings characteristics, setting out what good, outstanding and requires improvement alongside inadequate actually are expected to look like in practice. This is a really important moment for the sector to understand and influence the direction of travel and consider how the CQC have engaged and how providers will be engaging with the consultation process. We're really pleased to have Philippa Doyle, Hempsons partner, again leading today's session. Philippa brings an extensive career history and experience across health and social care, including CQC regulation, compliance, and her advisory work. And she will introduce herself shortly and will take us through where the system currently stands, what's changing, the consultation, and some practical steps that services should be taking now to prepare evidence, compliance, and position themselves strongly under both the current and also the future proposed approach. We've attempted to take on board as many of the questions that were submitted in advance upon registration, and Philippa is going to speak for about 45 minutes and try and address some of those questions as she goes, but we will leave the chat function open, and we want to try and keep the session somewhat interactive, but we have got a lot to get through today. So if you do have any questions or clarification points you want to ask during the session, please drop them in the chat function, and Philippa or I will try to get those addressed as we progress. Alternatively, we are going to have a Q&A session at the end, so you are free to raise your hand or ask questions at the end. Now, we are recording the session, so if you prefer to ask your question anonymously, I'll drop my email address into the chat shortly, and you can send me an email and I'll raise that question anonymously on your behalf. I would like to ask you all to keep yourselves muted whilst during the presentation. As Philippa mentions, please do make use of the chat function, and feel free to give a thumbs up to any question that's already been raised if it also reflects your own views, just to help us understand how important that is to multiple people. We are recording the session, as I said, and we'll collate any answered questions in an FAQ and send it out to you, if necessary, with a copy of the slides and a copy of the recording, certainly before the end of the week. So, without further ado, to leave as much time as possible for Philippa, I will hand over to Philippa and ask her to introduce herself and take you off today. Thank you. Philippa.
Thank you, Richard. Good afternoon, everybody. I hope the sun's shining where you are and that everybody managed to have a little bit of a break over the Easter weekend. Very grateful for everybody joining us in this session, and obviously those that have had an extra day, then they can catch up later on. So as Richard said, my name's Philippa Doyle. Many of you may have attended some of my webinars previously. I'm a partner and I head up the Health and Social Care Advisory team at Hempsons nationally. Been doing this for over 25 years now, always working with providers in the primary care, community care, out of hospital sphere, specifically with social care providers on quarter protection matters, information governance, and more latterly, a lot of work on CQC challenges and a real focus on training and advice to providers. I very much work on the basis that prevention is better than cure, and I would far rather support you to help present your service in the best possible way to help you get the best rating with CQC than for you need to pick up the phone to me after the event if things don't quite go to plan on your inspection. So as Richard said, a little bit of a catch up on where we are now. at the moment. Main focus on the new CQC documentation that's just come out for consultation in the last week, and then a little bit of a wrap up as to kind of how you can prepare and make sure that you're in the best possible shape for when CQC come calling, whether that's next week, next month, or indeed next year. So where are we now? If you are in the unfortunate position where they've turned up today or they turned up tomorrow, then there is no change to the current regime. We're still in the single assessment process. So that's technically an assessment rather than an inspection. And it's a two-part process. There's the cross the threshold observations where CQC physically come into your service and observe care that's being delivered, talk to the people that you support, talk to families, talk to staff members. And then there's a large paper-based analysis. At the moment, the general view is that the split is about 80-20. So people feel that about 80% of the time is spent on that paper-based analysis, and the cross the threshold observations are maybe only about sort of 20-25%. And that's something that CQC are really wanting to switch around. The reality at the moment is that it can still look and feel very much like an old style inspection, almost with somebody coming around with a clipboard, firing questions at you, wanting documentation, wanting information. It doesn't feel that different to an old style inspection. It's just that you're being assessed at the moment against those 34 different quality statements. CQC are still asking for PIRs, provider information returns. There used to be a time many years ago that if a PIR landed in your inbox or on your front doormat, that was kind of an indication that CQC were coming into your service and were likely to be there in the next kind of month or so. There is now no correlation with those timings. It's an automated, computer-generated email that comes out asking for that information within the PIR. That doesn't mean that you should ignore it. Please do still take the time to consider it, to fill it in with as much detail as you possibly can, because that gives CQC a real flavour for the service that they're coming into, gives you an opportunity to collect your thoughts, and really gives you an opportunity to start to showcase your service as well, because no one knows your service like you do. CQC have got their set standard questions that they will ask pretty much every provider, but it's your inspection. You've got to drive it. You've got to tell them what makes you different, what makes you special, what excellent work is going on within your service, because they don't know what they don't know. They're always going to give you a little bit of a list, set information as to what they want from you, what they want you to provide. My view is giving them answers to those questions is always the bare minimum. It's a little bit like going into a school exam at school. You know, if you give the absolute bare minimum answer, you may be only going to get 1 or 2 marks in answer to a question. But if you really give the examiner as much information as possible about your service, really kind of enhance how you're delivering care and how your service operates, it's going to give you extra marks. It's going to ensure that you get those 3s and 4s, those good and outstanding ratings. So this is very definitely not less is more, it's more is more. So if you've been hiding under a rock and you're not aware, at the moment we've got 34 quality statements spread over the 5 original domains, key questions of safe, effective, caring, responsive and well led. We had a consultation document that was released, long awaited, from CQC last week, that those 34 quality statements have now been reduced down to 24 key lines of inquiry or quality indicators. So very similar language to what we were used to before the single assessment framework came in, those key lines of inquiry, but the focus now seems to be wrapping everything together as quality indicators. So where are the strengths within your service? Still using those 5 original key questions, as I say, that we've all become very accustomed to, so there's no change there. And importantly, there's no change in the regulations underpinning the care that you deliver either. So those fundamental standards of care, the regulated activities regulations that have been in place since 2014 are still the same. There's been very, very little change to those regulations. So if you're familiar with them, if you've been through those regulations, if you're compliant with them, you're on a really, really good start to getting a good or an outstanding rating from CQC. I was delighted to be able to assist Care England and the Care Provider Alliance into inputting into the new documentation, the consultation documentation that's come out from CQC, but it's still not perfect. There is still a big opportunity for all of you working within the sector to have your say, to go through all of that information and to feedback on what CQC have provided so far. So the aim of the game was very much around deduplication and simplification, neither of which are very easy to say. But I'm very confident that actually that has been achieved. As I say, I was fortunate enough to be asked to assist in that process, and it was great to see the work that CQC had already done to streamline, and I've been really pleased to see as well that they've taken on board a lot of the issues that the CPA and I raised on behalf of providers in producing this kind of first solid draft for everybody's view. As I say, there's still some work to do. I heard Chris Badger, our new Chief Inspector, speak at the Care England conference a few weeks ago now. He would like to see the number of quality statements or key lines of inquiry down to 17. So he thinks there's still some more work to do. Whether what he wants to achieve and what others want to achieve are aligned, whether that will actually happen or not remains to be seen. But certainly if there is enough impetus within the sector and enough feedback from yourselves that you still think that there's room for the key lines, the quality indicators to be condensed and simplified even further, then now's the opportunity to say that because that certainly aligns with his thoughts and around what he wants to achieve. So at the moment, as I say, we've got a little bit of shaving around the edges. So the number of quality statements in SAFE has gone down from 8 to 7. Effective's gone down from 6 to 4. Caring's gone down from 5 to 3. Responsive from 7 to 4. And well-led has gone down from 8 to 6. I'm still calling them quality statements there. It'll be a while until we get used to calling them key lines of inquiry again, but we're broadly talking about the same thing. But in the main, unfortunately, I can't tell you everything that's in the consultation because that would take a really long time. You need to find the time to print it off, sit down with a cup of tea and read through it slowly. It's 64 pages long, but it's actually really easy to read. It's very clear. It's set out really, really easily. It sets out what the key question is, so whether it's safe or well-led. It then gives you the key line of inquiry, the quality statement that it's talking about. So it gives a little description of what that is and what it means. It then gives you a ratings characteristic. So it tells you what good looks like and gives you bullet points of exactly what CQC are looking for under each key line of inquiry to ensure you get a good rating. It then helpfully extrapolates upwards as to what outstanding would look like. So how you need to go the extra mile, what they're looking for to secure an outstanding rating for that key line of inquiry. It also then has a sliding scale as well. So it'll give you a description of what requires improvement service looks like and what an inadequate service looks like. So if you think you're teetering nearer the bottom end of that scale when you do that kind of internal analysis of your own service and whether you're hitting those bullet points or not, you'll be able to see really clearly and really easily kind of where the gaps are in your own systems and processes that you need to do in order to secure that rating going up from requires improvement to good, or potentially all the way up to outstanding. What you also then get under each key question is an I statement. And so that's about outcomes and the experience that people expect. So the people that you support, if they're in a position to be able communicate their wishes and feelings, what they expect to feel when they receive that service under that key line of inquiry. That's what CQC are looking for. So all of those 4 elements together form a quality indicator in relation to that one key line of inquiry. So you see that 24 times throughout this document, and it's broken down, as I say, into 24 individual key lines of inquiry, quality indicators, so you can see really clearly what you're being judged against, and how CQC are going to assess you. Consultation, as I say, only opened last week, and it's open until the 12th of June. So you've got a good 3 months to sit down and go through everything. That time will go really quickly. Apologies, just over 2 months. That time will go really quickly. So do make sure that you print it off at the earliest opportunity, and take your time to go through it. CQC are really obsessed with feedback, and they're obsessed with you securing feedback in relation to your own services. This is your big opportunity to feedback to CQC. They are really desperate to get this right. They, as an organisation, have hit rock bottom and are slowly trying to come back and try to ensure that they are the regulator that you need in your sector. So neither Richard nor I can stress strongly enough how important it is for you as a provider to take this opportunity to feedback on that consultation. All of the big providers will be doing it anyway, but we don't want the big providers to dominate the feedback on this service. We know that there are lots of you potentially on this call who maybe run quite a small, 12-bedded care home, or a much smaller service. Your voice is just as important as the big providers across the country. In fact, your voice is probably more important, because the impact that regulation has on you and your ability to be prepared and to respond to the quality indicators probably takes an awful lot more effort than it does in some of the bigger services who have whole quality departments who are aimed at supporting their managers and their services. So go through the consultation, as I say, sit there and read it and see if you find it as clear as I do around what CQC are looking for, whether it's right, whether it matches your service, whether you properly feel able to respond to it. And whatever you want to say about it, then feedback, share that information with CQC, because this is probably going to be the last opportunity that you get to do this for a good few years now. CQC are not going to go through another massive overhaul after this. They want to get this right. They want to make sure that it works for you as a sector. They're streamlining everything, so things are going to work differently for the NHS and for GPs now compared to how they work for yourselves. So this is really your opportunity. There is more to come. CQC have said that they will be providing some more detailed supporting guidance that will be in separate standalone documentation. So they're going to do an exercise on how the quality indicators map to the regulations, the fundamental standards of care, and they're going to give much more specific detail on what good looks like as well. So not just the bullet points that are already there for the ratings characteristics, they're going to do more of a deep dive, and they're also going to look at kind of subsector specific information. So at the moment, everything is provided in a more general adult social care field. They're going to look at more detail as to what good might look like for older people's services, for dom care services compared to care homes, for learning disability services, for services supporting working age adults. So there will be further opportunity to feed into making sure that specific detail looks right. So as I say, this is your opportunity really to seize the nettle and say what you want to say. In the main, I just thought it would be helpful to share with you my own personal thoughts. And I did a report for the CPA and for Care England. And actually, I was really delighted in reviewing the wording, making sure that it wasn't too NHS-y or too outcomes focused. And I've just put on the slide just an excerpt of my initial feedback. that I felt that the work done in the main to start with was very helpful to providers. I did find that the quality statements had been appropriately merged to reduce duplication. I found that CQC had taken the time to clarify what they were looking for to demonstrate compliance. And I do think that the quality statements, the key lines of inquiry, as they're now calling them, and the descriptors are much simpler and are much clearer. And so I do welcome the proposed changes as a positive. So I hope that gives you some confidence that things are heading in the right direction, because, you know, as Richard and others on the call will know, that, you know, if I don't think something's right, then, you know, I don't pull any punches. And there have been a number of things where, you know, I've had a bit of a fight with CQC around, you know, what I think is the right way forward. But I was very pleased with the work that had been done. There are still some bits and pieces. I still need to read through everything that's been published now in fine detail, and I'll be putting my own comments in on consultation as well. Some of the well-led quality statements caused me some concern. The governance and sustainability sections bothered me. And I'm really delighted that sustainability has actually been removed for adult social care. So you don't have to worry too much about being assessed on how green your service is. You're not going to be assessed in the same way that some NHS trusts are, as to, you know, whether they've got living walls or whether they've got solar panels on top of their car parks or not. Because I know that a lot of your services are just not in a position to do much more than reduce how much paper you use on a daily basis. There is still some wording in there that I feel is very outcomes focused. Obviously, in an NHS service, they're looking at reducing the number of bed days in hospital. They're reducing the number of revolving door patients and, you know, infections and things like that. Very difficult to measure outcomes in quite the same way in adult social care, unless you're looking specifically at goals and aspirations of individuals and whether those goals and aspirations are being delivered against. So they become much more focused on an individual's kind of outcome rather than an outcome of the service. So I think there's still a little bit of work to do on some of the wording in relation to some of those quality statements. And there is still a little bit of language kicking around that I find a little bit NHS-y that we need to feed back on. Just to flag as well around numbering and scoring. I like the scoring. I think there are lots of providers out there who like the scoring as well. I think when you come to try and read a report, it's very nice to know when you're looking at the individual quality statements or key lines of inquiry, whether you're scoring well or whether that's a particular area of weakness. Because for you as a provider, it really enables you to hone in on, right, you know, this is a pocket of poor performance that, you know, we need to address, but we know that everything else under this key question, under this domain is working well. The example I often give is that, you know, if things go wrong on the day of inspection in relation to infection prevention and control, that, you know, people haven't got their sleeves rolled up, people aren't wearing aprons and gloves when they're supposed to be doing, things aren't as clean as they could be on the day of inspection, you might get marked down, but the rest of the service might be great. So you know that that's a specific area that you can focus on. And certainly as a family, if you're reading a report, you can see quite clearly that, you know, that was one particular weakness on the day of inspection, but everything else is okay. So I like that scoring. CQC don't like the scoring, I think, because too much of it has been computer driven and maybe led by the algorithms producing the numbering rather than the judgment of the actual inspection team who've been into the service. So they have pushed really hard and have removed the numbering. So we're back to judgment calls from individual inspectors and individual inspection teams, but sat within the context of that description of what good looks like. So if you do need to challenge it, then you've got that description of what good looks like. If you feel that your service and what's described in the report also meets that description and yet you've been scored or requires improvement, then you've just got a different line of approach as to how to present that challenge. The other thing that we talked about as well was just having some numbered paragraphs within reports that just makes it easier to read. And if you are putting a challenge in, that you can say, well, I'm challenging paragraph 5 or I'm challenging paragraph 8. or numbering the quality statements. But CQC got very concerned that if you start numbering things, then people start ranking them and think that safe is more important than caring. It's all a nonsense, because they're literally just, well, this is quality statement 1, this is quality statement 2, this is quality statement 3. There's no judging or ranking there at all. We all know that safe and well led are the most important elements of the report, and if you get those right, then everything else should follow. But the halfway house that we seem to have reached is that we've got some very clear bullet points, and hopefully reports will be written with some very clear bullet points as well. So it just makes it easier for people to read, and also easier to raise points of challenge if we need to. So, ratings characteristics. This has been phase 2 of CQC's process. So phase 1 was very much looking at the quality statements. What do we do with them? How do we develop those? How do they change? And then phase 2 was looking at the drafting of sector-specific ratings characteristics. So what does good look like for adult social care? And so this has been very specifically drafted, aimed at your sector. There are different versions of the ratings characteristics for the NHS, for mental health services, for GP practices. And again, I was delighted to input into that process with Care England and the Care Provider Alliance. And we inputted into that process and had a little bit of a barney with CQC around what good looks like and how that's measured against the regulations. It's very much designed to give you providers a benchmark, but it works two ways, because it gives CQC inspectors a benchmark as well. There's been a lot of criticism over the years around the level of inconsistency between different inspection teams in different areas of the country, but also different training of different inspectors, depending on whether they were Andrea Sutcliffe trained or COVID trained, whether they were looking for good or whether they were looking for risk. So by starting with good for each key question and each quality statement, we've got, as I say, a set of really clear bullet points that you can measure yourself against, that a CQC inspector can measure a service against, to hopefully generate a level of consistency across the country. You then extrapolate upwards for outstanding, as I say, and down for requires improvement and inadequate. Now, my starting point for good has always been that if you are compliant with the regulations, then that should mean that you get good as your rating. The suggestion that's come through in the ratings characteristic documentation is that you could be compliant with the regulations, but CQC still score you requires improvement. CPA Care England and I are vigorously opposing that, and we will continue to vigorously oppose that in the submissions that we make back in the consultation. The view from one CQC inspector who I spoke to a couple of weeks ago was that actually we should have 5 ratings. Compliant with the regulations should be a compliant rating, and to be good, you need to be more than compliant, and if you are below par, then your score requires improvement. But we don't have that compliant rating, so at the moment we're a bit adrift as to what good actually means, whether compliance with the regulations is enough or whether CQC are looking for more. And what we really want clarity on is what that little bit more is. Because the analogy I like to give is that if you're driving in your car and you're in the 30 zone and you're driving at 29 miles an hour or 30 miles an hour, then you are compliant, and that means you're good. But if you do 32 in that 30 zone, then you're breaking the law. You're not going to get a speeding ticket, nobody's going to do anything with it, but you're breaking the law. So you probably requires improvement. If you suddenly put your foot down and start to do 38 in that 30 zone, then you're very definitely breaking the law. You're a long way past breaking the law. And that, in my view, is inadequate. CQC don't like that analogy because, in that analogy, they'd want everybody to be driving at 27 to be compliant with the law. So there's still a little bit of work to be done between ourselves and CQC and involving you too, around what the benchmark is for that good rating. Because I really struggle to have a provider who is compliant with all elements of the law, still getting a requires improvement rating. Everybody can require improvement. You know, getting a good rating, getting an outstanding rating, there is always more that you can do. But if you're compliant with the regulations, then as far as I'm concerned, that should make you good. So as I say, piece of work to do there, and something that I'm really quite passionate about, that, you know, we need that clarity for yourselves. Otherwise, you know, how do we get any kind of consistency? Generally, though, you know, I'll get off my soapbox on that one. The ratings characteristics are well written, they're well thought out. Little bits of inconsistency in there. In some cases, it was a little bit unclear how you got from good to outstanding, what the difference was. A little bit too much use of the word outcomes again, and NHSE language. And the word proactive used to creep in quite a lot as well. My view again is that if we're being proactive, then that's showing that we're an outstanding service. And so rather than that being used interchangeably between good and outstanding, I really just want to see the word proactive used to describe an outstanding service. But there isn't currently a line-by-line description that kind of links all the descriptions in each new key line of inquiry with each rating characteristic. So there's still a piece of work to be done to make sure that we've got the right level of detail and the right level of information. So, you know, 294 brains is better than one. If everybody on the call took the time to sit down and go through the documentation and gave some feedback on it, even if it's only across one or two areas that are your particular bugbear, then that would all be hugely appreciated by everybody. So as I say, the next step is now phase 3, which is the subsector reviews, and that's about adapting each of the ratings characteristic for each different type of service, so whether that's learning disabilities or older people's services. But it's very much around using this consultation as your opportunity to say what you want to say to shape your regulator. People will often say to me, well, who regulates the regulator? And actually it's you. You know, only you can let CQC know if an inspector's behaved inappropriately, if a report doesn't reflect your service. You're the only other person that was in the room at the time. But this is a blank sheet of paper. This is your opportunity to give feedback and to shape the regulator into the way you want them to work, so that it works well for your service and for your industry. So this is almost like a once in a lifetime opportunity, really, to have your say, to make sure that everything is as right as it can be moving forwards. So where does that leave me now then? Regrettably, the timetable for implementation is still several months away. I'm not going to hazard on a date. The C word has been mentioned. I think the reality is that we're probably looking at round about this time next year before everybody is in a position where they're being assessed against new key lines of inquiry. So in the meantime, very much business as usual. So if CQC turn up tomorrow, as I say, still using the current system, and you still need to be prepared. CQC will tell you you don't need to prepare, you can just open your doors and your service should be wonderful, and the inspector will walk in and will find everything they need to find. That's fantastic. Sometimes that does happen, but that's a little bit like walking into an exam at school and being one of those amazing people that everything just falls out of your head onto the page and you get maximum scores for everything. Just doesn't happen with most of us. Most of us need to sit down and do a little bit of revision for exams, put that preparation in to make sure that we've got the right information, so that we can make sure we answer the questions in the right way. So my view, and certainly the view that the Outstanding Society have been supporting people with for many, many years, is just take the time to prepare. Think about each one of the individual quality statements. Think about what evidence you've got within your service that demonstrates compliance with that quality statement, and start collating all of that information together in one place. Whatever you do now, even if CQC don't turn up for your service in a year's time and the process has changed, it will not be a waste of time. It will always be useful for you to audit your current service and prepare. It will always be a useful opportunity for you to look at whether there are any gaps or weaknesses in your systems and processes, and take steps to address those gaps and weaknesses. We all know that CQC love an audit. Use preparation for inspection as an audit tool. Take those individual quality statements and start breaking them down and think about what good evidence you've got within the service. Many of you will know that Care England and I partnered together to create a toolkit that has been used by many providers with some really excellent feedback to say it's really helped them to hone in on what good quality evidence they've got within their service. Because so many providers will say, oh, but the staff just shrug their shoulders and say, oh, it's just what I do. There's nothing special in it. But actually, you're making a difference to people's lives every single day. And that is special. And where so many services fall down is because you're doing great work, but you're not necessarily capturing all of the information. You're not capturing the evidence of that good work that's going on within your service. So what we're seeing across the board is that services of all shapes and sizes, whether you're a really small service or whether you're a big multinational, the ones who prepare for inspection are the ones who are getting the better ratings. It's like passing a driving test or a school exam. It's very much an art. It's about you demonstrating to the examiner, you demonstrating to the inspector all of the good work that's going on within your service and all of the knowledge that you've got. They don't know what they don't know. They don't know what you know. Only you know, and only you can describe what's going on in your service. So they've got all their standard questions. And so you make sure you answer all of those standard questions. But if you've taken the time to think ahead and to prepare about, well, actually, I've got all of this evidence of, this outstanding work that's going on, or this is what we do with our staff teams, or, look at the work we do with our support plans, and how we work with people's goals and aspirations and how we demonstrate compliance with those goals and aspirations, making that really specific and tailored to the relevant quality statements or the relevant key lines of inquiry is really going to help on the way to getting those really good ratings. It's your service, it's your inspection, so you have to drive it. And no, it's incredibly intimidating, but the inspectors are just people. Most of them want you to succeed. Most of them want you to come out with a good or an outstanding service. So work with them and help them achieve that. And certainly Chris Badger's view, as I mentioned earlier, is that he wants services to be, and inspections to be much more focused on what's going on in the service and less around the paperwork. So he wants to turn around that 80-20 split. He wants inspectors to spend 80% of their time just observing and chatting and having conversations with people in service, and then checking that the paperwork matches up to what's being delivered on the ground, rather than letting the paperwork drive the inspection. But the paperwork's still got to be right. Your care plans have still got to be consistent with your risk assessments. That information has still got to be there so that the inspectors can be satisfied that this isn't just a case of, we know everybody so well that, we can do it with our eyes closed. The documentation has still got to be there to back everything up. So divide the quality statements up month by month into chunks so you can maybe cover 2 or 3 of them in depth. And remember, this isn't just for you as a registered manager or an owner. Get everybody involved in thinking about what good evidence you've got, because what a carer on the ground might think is good evidence might be something that's never even occurred to you as a manager because you're slightly removed from the process. So start to build up folders, whether that's hard copies or on a shared drive, somewhere where everybody can kind of drop evidence of good examples of something into that system, and you can start to build up portfolios so that you've got information. So when an inspector comes into the service and says, oh, can you give me an example of you know, what somebody's goals and aspirations were and how you've helped achieve that, you can immediately say, oh yeah, well, you know, here's Betty's file and this is what we were doing with Betty, and you know, this is how we changed things, and this is how we were able to support her from, you know, not being able to get out of bed, to being up and dressed every morning on her own and doing X, Y, and Z. They don't have to be really big ticket items. They can be something as simple as, you know, getting a smile out of miserable Mary. Anything can be a really valuable goal and aspiration that's made a difference to somebody's life. But then it's about analysing your gaps. As I say, CQC love an audit. They love an audit that identifies gaps and deficiencies, and then they love an action plan on fixing those gaps and deficiencies. I always say keep them really short and sweet. If it's a nice little short list of to-do things, you might get them done in the day, you might get them done by the end of the week. Delegate them. Get other people to do them. You don't have to do them all, but make sure that those action plans are really clear, and that they get signed off. And then you can present those to CQC as well as evidence of good governance, because your auditing is identifying issues, and then you're addressing those issues as well. Look at where your gaps are though. Sometimes that's MCA assessments that haven't been reviewed properly. Sometimes it might not be feeding back to a service on changes following a complaint. Sometimes it might not be going back to the complainant after a particular complaint's been addressed. Make sure you're picking up on those little bits and pieces of things, because that can often be where a service falls down. But if you're going to start anywhere, focus on safe and well led, because as we know, those are the most crucial elements of the service. And if you find the whole thing really daunting, then there are 4 quality statements at the moment that are all about staff. And they're the heart of your service. And when you look at those 4 quality statements and what evidence you've got to demonstrate compliance, you'll actually really realise that compliance with some of them is really easy. You've got all your policies, you've got all your procedures, you've got your support in place, you've done your recruitment checks. You know, you could tick all of your boxes in relation to those 4 quality statements. And if you do those with the staff teams as well in one particular month, that will really give you the confidence to go on and look at more, and particularly look at some of the ones that are a bit more complex and a bit more detailed under safe and well led. But otherwise, a little bit of a whistle-stop tour as to where we are and where we're going. But Richard, over to you, and any questions from anybody?
That's amazing. Thank you so much, Philippa. And just to kind of bring back to the surface, I mean, nothing's changed. The single assessment framework was the same as the previous framework in terms of the regulations, the fundamental standards. So we're doing what we've always done. It now just looks a little bit different, and they were very, very wise words and some great advice and support. So thank you very much for providing those. And publicly, I think it's appropriate that I thank you for all the support you've given us, Philippa, personally at Care England and the Care Provider Alliance. They're helping us work with the CQC over the last sort of 4 or 5 months, with very frantic timelines to get all of this reviewed and understood. And you're absolutely right. This is definitely an improvement, but there is still a little way to go, and there are definitely questions that still need to be answered. The consultation isn't perfect, but it really is an opportunity for everybody on the call today to have their say. And we really, really do encourage you to have your say. As Philippa said, you don't have to review the whole 64 pages if you feel that you don't have the capacity to do that. But if there's 1 or 2 bits that sort of really stick in your clack where you want to have your say, that is really, really important that you do have your say. So please do so. It's your chance. And you don't really have the right to complain afterwards if you don't have your say now. So we really want you to do that. I think the challenge is over sort of the position in terms of what good looks like in some areas is definitely some work we need to do. I did drop the link into the chat to the toolkit that Philippa talked about. And Philippa, I'm just going to just confirm with you, but I believe anybody who purchases that, they'll get an updated version once the consultation has succeeded and there have been changes to the toolkit. Is that correct?
Yeah, that's absolutely right. My plan at the moment, I'm reserving judgment. I'm really hopeful that the documentation that comes out from CQC will do the job properly and will give you all of the information that you need in one place. It's looking really positive at the moment that is what is going to be produced. And if CQC do the job right, you won't need anything else from me. So there won't be a version 2 of the toolkit. But if things aren't quite how I hope that they will be, and that my optimism is shot through, and I do produce a version 2 of the toolkit, then yes, absolutely. Anybody that's bought version 1 will get version 2 free of charge. And anybody that's still interested in version 1, as I say, it breaks down each of the quality statements, builds them back up again, gives you those bullet points on what you need to know, what it means. And certainly the feedback that I've had from any number of providers is that it's been really helpful for them. So that is still available for purchase if anybody would like that version of it.
And I know you're very subtle. You never publish and try and sell and market that, but I just thought it was really important to put it in there, because actually it really does provide that foundation for anyone who hasn't been inspected under the new framework, or even if you have, just to really take a good look at it. I just want to one question that kind of came up was really around this professional judgment. So the scoring's gone. Some people will think that's a positive. Some will think that's not so much of a positive. I'm in the camp of actually I'm upset that the scoring has gone, because I quite liked. I'm a numbers person, and for me it worked very well. But in terms of professional judgment, what are your views on kind of inspectors applying their judgment consistently, Philippa?
That's always going to be a difficult one, because where you've got people judging people, it is very difficult to step away from any kind of bias. Everybody is always informed by the last service that they inspected. And if they came across particular areas of practice that they didn't like in a particular service, that may well be at the forefront of their mind when they come into your service, and they will be looking for that again, and whether there's that particular concern there. So there is always going to be an element of inconsistency that it is impossible to totally eradicate. CQC were trying to eradicate it by what became an over-reliance on AI and kind of auto-generated results. There has to be an element of discretion in there, and there has to be that human input, because we've got people looking after people. We've not got robots looking after robots. And so all I can say is that having the very clear ratings characteristics now with the clear bullet points gives you the opportunity that if you think an inspector has gone a bit rogue, and what they're talking about and the rating that they're giving really just doesn't match the service that you believe that you deliver, then you must challenge. There is an opportunity there. There is a framework there. The actual accuracy challenge process is there. The rating review process is there. It is yours to use. You can do it on your own. You don't need solicitors, but I'm also very happy to assist where I can to make that as robust as possible. And services that fight do get things changed. There are lots of times when things don't change, and that's often because the service has perhaps been a bit unrealistic, or the evidence really just isn't there to justify the change. But there are also lots of other occasions where changes do take place, and it is really worth pushing if you've got the evidence there.
Brilliant. And again, I've just had a question via email, actually, just in terms of the CQC toolkit, just to confirm that it really addresses supported living services as well.
Yep.
Which, yes, fantastic, wonderful. At this point, if there's anyone would like to kind of raise their hand to ask Philippa a question directly, please do so. We've got Philippa for another 12 minutes, so it's really, really helpful if you want to sort of come in and have your say. I have got lots of other questions that came in previously, which I'll have a skim through to make sure we've addressed. I think Michael makes a point there around VAR regarding opinions.
Yes, I saw that one come in as well.
That's an interesting one. Maybe we won't go down that rabbit hole just yet. Philippa, you talked around focusing on sort of safe and well led. Would you like to just expand on sort of like the key aspects you feel that care providers should, have under their belts routinely? And then we've got a question from Tony as well.
Yeah, absolutely. So what the key areas where providers are at greatest risk is Regulation 12, the delivery of safe care and treatment, and then Regulation 17 around good governance. And both of those are interlinked because they're looking at assessing risk and then doing all that's reasonably practicable to manage those risks. And where services fall down is they might have assessed risk, and so they've done a risk assessment on an individual, but they've not updated a care plan, or the risk assessments that they're relying on might be a number of months or sometimes even years out of date, that although the carers know the people that they're supporting really, really well, and they anticipate areas of concern and how to support somebody, again, it's the documentation that tends to fall down, that it doesn't necessarily reflect the position on the ground. So we have any number of cases. I'm working on one at the moment where the service is managing people with some complex behaviours that challenge. And what CQC have been most concerned about within the service is that the risk assessments and the care plans don't give sufficient detail for staff members on how to support somebody, there's very generic comments around, de-escalating behaviours, but it's not giving any real tools on how to de-escalate those behaviours. So it's about being as clear and specific as you can in those areas when you're doing those risk assessments, because as I say, that's where services are most at risk. Those are the things that CQC tend to hone in on.
Brilliant, thank you very much. And we've got a question from Tony. Tony, would you like to come off mute and ask a question?
Yeah, thanks for that. It's been really interesting. But one of the questions I wanted to raise was around the portal. So is there going to be any changes to the portal, because it seems to become quite stagnant again, where there seems to be no flexibility? Initially, it was set up to enable portfolio building and submitting pieces of work, where it just seems to become now about notifications. So you might be able to give that. Sorry, go on.
I was just going to say that feeds into Chris Badger's view that we need to move away from this over-reliance on paperwork. The original idea for the portal was that it would be a tool where you could upload information. If you'd scored a 1 or a 2 in one particular area, then you could upload your documentation and CQC would be able to look at that in real time and say, oh yeah, Tony's fixed that particular issue. We're going to, change the rating on that particular quality statement that might have changed, the rating for your whole service. That never actually worked. That never happened. It never got to that point where the portal worked in that way. And certainly what I've heard from CQC is that because Chris Badger wants to focus much more on spending 80% of the time actually in the service on the ground, talking to people, and then doing a little bit of a check on the documentation, he wants that check on documentation to be done within service. He doesn't want there to be a need to spend hours and hours and hours uploading loads and loads of documentation onto a computer system for an inspector to look at after the service. After the inspection, he wants all of that to be viewed whilst you're in service, and there might only be a few bits and pieces that you might need to put on an email after the event. So the idea is, my understanding at the moment is they're looking at moving away from the use of the portal completely, and it will be much more around kind of those notifications and formal things that you need to tell them about, rather than the way it was originally designed with the single assessment framework.
Brilliant, thank you.
Wonderful, wonderful. There was a question that came in around the PIR, multiple PIRs for the same service. I'm not sure we can really answer that directly on here, but if you did want to email me directly, my email address is in the chat. We do have a tool, the Smart Care Intel tool, where you can load your PIR up and get a report based on what the CQC would think about your PIR. So we're looking for some providers to test and shape that. So if you are interested in doing that, please just drop me an email directly, and we'll support you with your PIRs. In terms of, there's quite a lot of questions came in previously around reinspection of services. I don't think we can answer that, but as Philippa said, is that Chris Badger, his view is very much to move away wherever as much as possible to get back to more balance around planned inspections versus whistleblowing and sort of risk-based assessments. They really want to start getting through that backlog. So there is a huge effort on that, and much of what they're doing is to try and create the additional capacity to be able to do that. Yeah. And really focus on it.
I know in certain areas they just don't have the inspectors on the ground. So we were talking to one manager in one area who said, I've only got 6 inspectors and about 6,000 services. I'm carrying 13 vacancies at the moment to try and recruit inspectors. there had been a real focus from CQC on risk being based on safeguarding concerns and notifications. They've changed their risk framework so that services that haven't been inspected for a long time are also now considered to be at risk, because that rating is quite old and in some cases quite stale. But they've still got this problem of not having enough inspectors on the ground because nobody wants to be a CQC inspector anymore. But I know if there are particular concerns, we're doing some work with a service at the moment who, although they've addressed all CQC's concerns, so they won't come back and re-inspect them, they're still left with a requires improvement rating, which means it's impacting on their insurance level, it's impacting on their ability to win contracts with local authorities, it's impacting on private residents coming through. So CQC have said that they will look at that, and particularly if you're able to demonstrate that it's having a significant financial impact on your service, then CQC will revisit whether they are able to recategorize a service as to where it sits in that risk matrix, to potentially get someone moved up the list as to when they might be inspected.
Brilliant. There's also some work we're doing with the care accreditation framework as well to try and help have CQC third-party inspections recognised, non-CQC inspections recognised by the CQC, and we're trying to do some work with the CQC on exactly that point. Ruth, you have your hand up. Would you like to come off mute and ask your question directly to Philippa?
Yeah, thanks, Richard. It's not really a question, it's an observation, is that in January I was fortunate enough to spend a few hours with Chris Badger, and he made my heart feel a little bit lighter. Which hasn't happened as a provider for a long time. I felt that he was honest, that he was open to listening. He's very keen on knowing what families feel, and how they can get their views across. And it was just a really good few hours. And I'm really glad that I had that opportunity. So it's just that I wanted to share it. That he's,
Thank you, Ruth. Yeah, I felt the same. It's a positive fresh of breath air from somebody who really understands the sector and understands that the sector operates very differently to the NHS as well. So yeah, I'm trying to be really optimistic that the change is going to be a positive one, and I do feel that we're heading much more back towards Andrea Sutcliffe days of, would I be happy with my mum in this service, rather than that very police kind of black and white period that we had sort of during COVID.
Brilliant. And I mean, we have had some fantastic feedback since Chris has been on board, and we've worked with Chris for many times in his time as the DAS at Hertfordshire County Council. He has been a provider himself. He has been inspected. I think they had a requires improvement service, so he understands what it's like to be inspected and be on the receiving end of it. And I think we've seen some incredibly positive changes so far, and he's not been corrupted by the old CQC ways. He's sticking with what he's doing in the direction of travel, and I think we're more positive than we have been, but he's the first to recognise we're not there yet. There's a long way still to go, but I think we all need to kind of just be grateful for the fact that we have got someone who seems to be helping us to move in that direction. But again, they really do want the feedback. So if you're not happy with something, please provide that feedback. Provide it through us, the representative bodies, or provide it directly to the CQC, because they have their listening ears on at the moment and they are taking note. And the consultation is the best possible way for you to be able to do that. Now, I am going to draw things to a close. Thank you very, very much for the questions that came through. Thank you all for attending. I know your time is incredibly valuable, and thank you again, Philippa, for making this a very successful event. We'll make sure the recording goes out before the end of the week, along with a copy of the slides. If you need anything else, please do reach out directly to either ourselves at Care England or to Philippa directly. We are all here to help. There is a Hempsons helpline as well, which will make sure that information goes out. If you have got any quick questions that you want to ask, you can take advantage of the Care England Hempsons helpline. Please use all the resources at your disposal, and we wish you all the very, very best. Thank you so much.
Thanks, everybody.
Thank you.
Thank
Bye.
you.